Hi, I'm Dr. Joe LeMaster, the local health officer for Johnson County. We haven't been back to give you an update on COVID-19 status for a while, so wanted to do that today. In the recent weeks, after the lull that we experienced after the Omicron surge of the winter, during which we had a very low amount of transmission of the virus, we're now starting to see much more of that. Positivity rates are about 17% among those who come for testing, and overall the incidence is about 168 to 170 per 100,000 people. This means that the number of cases out there and the virus out there circulating are much more than they previously were. This means that it remains important, and we continue to recommend the use of masks in indoor spaces, especially where there are large crowds of people that you cannot socially distance from more than 6 feet or more. So I want to talk a little more about the impact of the vaccine on our recent Omicron surge, what is coming out. If you had not been vaccinated and you got COVID, the antibodies that you developed after that were only focused on the Omicron version that you got. So if you got BA.1, you would have antibodies against BA.1. But those who were vaccinated had antibodies not just against BA.1, but also against BA.2 and the previous versions of the virus, including Delta. So the vaccine does a very good job in producing neutralizing antibodies, not just against the specific virus that you were exposed to, but against the whole range of viruses. Moreover, neutralizing antibodies against the BA.2 infection were very high after a third dose of the vaccine, so after the booster. Among those who developed the childhood form of the very severe immunological reaction to the virus, the so-called MIS-C reaction, those who were hospitalized, 95% of those were unvaccinated, and among those who got MIS-C after vaccination, none of them required intensive care or ventilation or anything like that. Now to talk a little bit about long COVID. Among people who were hospitalized, about 50% of them developed some aspect of long COVID. And we are aware that those long COVID symptoms can last for many months, usually about 6 months. They are most commonly associated with some kind of shortness of breath or fatigue or brain fog. About 50% of those who were hospitalized had some element of long COVID after their hospitalization. Whereas vaccinated people were 35 to 45% less likely to die if they were hospitalized with COVID. With respect to long COVID, those who were vaccinated, fully vaccinated, were half as likely to develop long COVID symptoms, that is, symptoms that went on after 28 days. On the other hand, those who were only partially vaccinated were as likely as those who were unvaccinated to develop those long COVID symptoms. Overall, the point we want to make here is the vital importance and role of vaccination in protecting yourself and your family, as well as your friends, colleagues, and neighbors, not just from hospitalization and death from COVID, but also from those debilitating impacts of long COVID that can go on and on and on.